This is Miriam Raftery with East County Magazine, and I'm very pleased today to have with us Dr. William Tseng. He is the Assistant Area Medical Director at Kaiser Permanente, as well as Kaiser's vaccine lead and resident expert on the COVID-19 vaccines. Dr. Tseng, welcome to the show on KNSJ 89.1 FM.
Thank you very much for having me.
Well, you're welcome. We'll also be podcasting this on our site at East County Magazine. I guess the first question of the day is the FDA has just approved new booster shots. Can you tell our audience out there who is eligible for them and how soon the boosters should be available here?
Sure. I think let me start off a little bit backwards and for the baseline, just to get a general understanding for the audience, because we hear FDA, we hear CDC. What's the relationship and how does it work?
Good point.
So, FDA, so thinking about FDA, what their responsibility is really to protect the public health by assuring safety, efficacy, and security. So any drugs, anything like that, their goal is to make sure that it's safe and it works. CDC, on the other hand, or slash ACIP, that's the other term you'll hear, is really the Advisory Committee for Immunization Practices, ACIP. They're a subset of the CDC. Now, what the CDC does is that it develops recommendations on how the vaccine should be used. So one says that it's safe and efficacious. One tells you how to use it. So that's the relationship. And we obviously hear, FDA approved it on this date, and then now ACIP approved it or CDC approved it. So that's the relationship.
Yeah, thank you for clarifying that. It is sometimes confusing to keep track of it all. So that said, who is now eligible for booster shots? Originally, I should clarify, it was up until now, it had been just people who got the Pfizer vaccine.
Correct.
And for that, it was people over 65 or people over 18 if they had certain pre-existing medical conditions, or if they worked in an occupation where they're at risk because of a lot of contact with the public and with potentially unvaccinated people. Who else can now get it?
So what the CDC said is they want to be aligned with what their recommendations were for Pfizer vaccine. So you're absolutely right. If it's been 6 months' time, anybody over 65 or older or live in a long-term care facility, they should get the booster vaccine. They are really the group that I am most concerned about.
Yeah. People
50 to 64, if you have underlying medical conditions, you should receive a booster if it's been 6 months. Now, 18 to 49, these are the ones, if you have underlying medical conditions and you're at if you feel that there's an individual benefit versus risk profile, they can also receive it. And then the last group is who you talked about, 18 to 64, who work at an occupational institution, which may expose yourself or expose others to that setting. That's a healthcare setting. So
yeah, it's actually not just institutions. It was fairly occupations, so grocery workers. I actually got one as a journalist because I'm out covering things like rallies of maskless people protesting against the vaccine. So obviously I'm at risk if I'm interviewing people mask off in a situation like that.
Yes.
So I think a lot of people may be eligible who might not realize they're eligible. Now that was Pfizer. Is the same true now? The same standards for Moderna for Johnson Johnson?
But Johnson & Johnson, what they said was that if it's been 2 months' time since you received your first one, then go ahead and get the Johnson & Johnson booster. And then the question that also often comes is, well, should the Johnson & Johnson have been a 2-shot from the start or not?
Yeah, because it's been a lot less effective. I think early on it was only 70%, and it's dropped by some counts, maybe even into single digits after it's been long enough. So yeah, the real question I think is that Johnson & Johnson people are facing is, should they go get the same thing? Or there's been some talk about mixing and matching, and perhaps allowing people to go get a different vaccine. Say you got Johnson & Johnson and you want maybe better protection from one of the others, or perhaps you had an adverse reaction to one of the other ones and you want to get something different. What is being allowed, and what would you, in your professional opinion, advise people to do?
Okay, so let's start off with the Johnson & Johnson. So Johnson & Johnson had a trial for the second dose. And what they found out is after the second dose of Johnson & Johnson vaccine, your protection against hospitalization or a significant disease actually is perfect, 100%.
Wow,
So
it doesn't get any better than that.
right, but let me phrase that by saying I'm sure there's going to be some waning immunity. So don't bet on that 100%. I'm
We
sure
don't
there's
we don't
gonna
know
be,
how long that would
we don't know
last.
how long that's going to be.
Mhm, mhm.
However, what we do know is that if you get the second dose, you do get that protection. You get that bump in protection again.
Very good.
Now, yesterday, the ACIP essentially said, look, you can mix and match. What they're basing it off is safety.
Hmm.
Now, there are data to say that you can get a little higher antibodies, neutralizing antibody levels if you mix and match. But does
Interesting.
that change? Does that delta and increase? Is that really going to protect you against hospitalization and death? And that we don't have data for. So what we can say is you may get a little higher bump, but we don't know if that little bit higher will give you that benefit. What we do know is that if you do get the booster shot, then you have a higher antibody level, which can prevent you from getting infection.
There you go. What would you say to people, including a lot of those I talked to the other day at the protest who were concerned about, vaccine mandates, especially for kids? What advice would you offer those who are concerned about serious vaccine adverse reactions? I know they're rare, but there certainly have been blood clots with Johnson and Johnson. Sorry about my cat that's Zoom bombing us here. As well as some heart issues. I believe the heart things are temporary, but with the other vaccines, how concerned should people be? And are there any categories of people who should perhaps consider one vaccine or booster over another?
Yeah, and so there, when CDC looks at it, definitely we're looking for any adverse reaction and any type of adverse reaction. We bring that forward.
Mhm.
And really, CDC has done a good job in terms of collecting all that data, and it's publicly reportable
Yeah,
as well. What you really have is a lot of anecdotes, and basically, hey, I had a friend's friend who had this
right.
reaction, so I'm not going to do that. What you really want to look at is the true reaction rate and the true adverse reaction and the true death. We can tell you for sure that the case fatality rate, meaning if you have COVID, um, how many people will die? And it's about 1 to 2%. It used to be up to 5%, but
Yeah.
because of the way we've learned how to treat patients, it's down to about 1 to 2%. So
But what
that,
about long COVID, though? It's good that the fatality rates drop, but
yes,
there's also a significant number of survivors who are left with long-term damage to heart, brain, lungs, and some of the things people worry about with the vaccine, I understand, like clots and heart damage, can happen at a higher rate with COVID. So how high is that long COVID rate? And basically, how risky is COVID for people versus the risk of the vaccines?
that's a great question because long COVID can be up to 20 to 30%.
Yeah.
And most of it is not going to be people who end up in the hospital. I mean, you can get it. Most of the patients that we see are outpatient
Mm.
who have COVID. So
And does that
it's
include a lot of younger or middle-aged people, kids,
yeah, can
Mhm.
kids as well. Teenagers, even young adults. They're the ones who can get this, and again, up to 20 to 30% have
A
symptoms
lot.
last to 6 months or even longer. So it can affect us, and it will affect us, and we will see some of the consequences from this.
Right.
But in terms of kids, let's just talk about kids. American Family Pediatrics, American Academy of Pediatrics has been putting out this website where it shows you how many kids are affected by this. And a couple of weeks ago, when it was bad, 250,000 kids a week were getting COVID.
Wow.
And you can only, in the US, there's only 7 states where there are no death from COVID. So it may be a lower risk, but kids are not at no risk.
Yeah, I interviewed a doctor from Children's Hospital the other day who advised us that they've had several hundred children who were sick enough with COVID to be admitted to the hospital, 75 in the ICU, I think another 75 with the multi-system inflammatory
That's right.
disorder that can be very, very serious. So it's kind of a myth that it doesn't affect kids, maybe
Yeah.
especially with Delta that's spreading so much more easily. So more of them are getting it now.
Right. And actually, there was a case that CDC studied where a teacher, and this is again publicly reported and public information,
Mhm.
but a teacher who was not vaccinated went to school, and she was trying to read to the kids, and she thought the mask was was a hindrance to the her volume. She removed the mask and read to the kids, and you can see every kid on the first row caught it. Some of
Oh,
the second
no.
kids got it, and 50% of the kids in that classroom caught COVID. And not only that, they spread it to other people, like their families and siblings. So
And
it does
yeah,
happen.
that's the even greater risk, I think, is not only the children getting it, but they may pass it along to somebody who does not have a strong immune system, who would be more vulnerable. Maybe if they have a cancer patient or an elderly person or someone with an immune disorder in their home. I mean, my understanding is that even things like obesity and diabetes put you, high blood pressure, all those things put you at a higher risk of a bad outcome from COVID.
Yeah, and there's actually another one that's very interesting. There was this kind of reporting of two summer camps because summer just ended. They looked at all the studies from that, all the data came in.
Mhm.
There's two, kind of a tale of two summer camps. One of them had 9 sites, 93% vaccination rates on everybody all the teachers and summer camp
Yeah.
counselors. They were overnight cohorting, and
Mhm.
out of 7,000 campers, there was 9 transmissions. 7,173 campers and staff.
So
There
that's
was
very low. That's not even 1%. Yeah.
so there's the other summer camp,
Mhm.
28 camps, 50% their day, 50% night had cohorting, the same thing.
Mhm.
No recommendation for masking, no recommendation for vaccination. It was just saying, well, if you want to get masked, mask. If you don't mask. Um, they had out of 2,988. So instead of 7,000, they had about 3,000.
Mhm.
321 people got it.
That's
So
10%.
10% versus 0.1%.
Point one. Yeah.
Yeah,
Oh,
one for
gosh.
the other one where they had mandated mandated mask and vaccination,
So
and that was
clearly
only
those
90.
things work. Yeah.
It works. It really works, and our goal is to really save lives and make sure that you don't get it. Now, certainly, you know, if there's reasons that you can't get it, that I understand, but if you
Yes.
can't prevent each other, help each other, prevent the spread of COVID, prevent unnecessary death.
Yeah. I will say we had a close relative who died of COVID, 50-year-old man in good health with 5 children left behind. And he got it because the one coworker that he shared space with brought his unmasked, unvaccinated teenagers in
Yeah.
and to the workplace, and not knowing that one of them had COVID, and it spread to his whole family. One got long COVID, and our relative unfortunately died after many weeks on a ventilator. So uh, it's certainly a myth that kids and teens, don't get it, or that they can't spread it to somebody else, and you just don't know what the outcome will be. Sometimes tragic.
Hey, they actually did a study, again, very interesting study on kids and COVID, and they broke it down by age. And if the kids do catch COVID, it's the youngest population that transmitted to their family members, and more likely
Mm.
because they're really young. You want to be hugging them, you want to be cuddling with
Yeah, and they might be coughing and sneezing and not covering their mouth and not running around, not probably wearing the mask at home, and or around people as much as maybe an older, say a teenager might know to do.
them.
I want to go back just for a minute to the side effects, because that seems to be what most those who aren't vaccinated, it seems to be the biggest fear that they cite, that maybe these things, are too experimental, especially for kids, or they're concerned about, the side effects. Can you explain to us how rare are the serious side effects in adults and children? And if you were a parent weighing getting a vaccine for your child, you know, would you do it? And is there one vaccine that you think is perhaps more suited for children than others?
Yeah, so those are great questions. Number one, you know, there's two types of protection when we give a vaccine. There's a sterilizing immunity, and then there's a protective immunity. Sterilizing means that you get the vaccine and you never catch it again.
Mhm.
Protective immunity means you get the vaccine and you're protected against severe disease or even death. And that's what the vaccines have all been studied for and powered to do. So yes, it is not perfect. I completely agree with the arguments that, hey, there's side effects and you may not get 100% protected. But it's like saying, okay, if I wear a bulletproof vest, I'm going to be much better protected than if I don't. But you can say, well, yeah, you go a bulletproof vest, it still hit you and it still crack a rib. Well, if I weren't, I would be
You'd be
dead.
dead. Yeah. It's like saying don't wear a seatbelt because someplace, somebody got tangled up in one when their car flipped over and they couldn't get out. But for every person that happened to, there's probably
Right.
a million others who were saved because of a seatbelt. You can ask any CHP officer about that.
And so look at the real risk. Don't look at the perceived risk, or I mean, look at the facts rather
Yeah.
than.
And I want to hammer home these things that people hear about, the scary sounding stuff like clots and, heart inflammation. Aren't these like a couple cases per million? I mean, it's very, very remote.
Yeah. So the first one that happened here in Petco was really that anaphylactic reaction, right? And it came out to be about 5 in a million or 1 in 200,000.
Which
And
is totally treatable, isn't it? If you just wait
100%
a half
treatable.
hour and get
Right.
treatment. I've had anaphylactic shock myself, not to a vaccine, but to two other things.
Like
And
a beer thing, right? You can treat it. We know exactly what to do. And the reason CDC puts these out is because if we know what the reactions are, we can treat you quickly. And I think they have done a great service to the medical community by putting everything out there, big or small, putting it out there. I mean, if you look at the pericarditis risk, and that's the one that you're talking about.
That's the heart inflammation, yeah.
That's heart inflammation. You are 16 times more likely to get pericarditis if you catch COVID.
Yeah. And even if you get it, isn't it generally treatable now? So people get over it, even if that happens.
Basic and observation, you may take some aspirin or ibuprofen and then it goes away. And you're
okay. So it's kind of an overblown fear, really.
Yeah, but we don't. I don't want to say it's overblown. I think it's appropriate that we know about it,
correct,
so that we can monitor it. But if you're looking at the risk and benefits, the benefit far outweighs the risk.
Right. And now, that was associated with the mRNA vaccines, right? The Pfizer and Moderna, but it's treatable. The clots that some people have been concerned about, I believe, were only Johnson and Johnson. Is that right?
That was Johnson and Johnson, and we also know exactly what to do in these cases. So we know if there's this different type of clot, you don't want to give blood thinners reflexively. So again, that education has permeated the medical community, so we know what to
do now. Yeah,
catch it early, and it's not like it's not like everybody who caught it died. No, not at all. Yeah. It's we want to mention everything we see.
Exactly. Well, that's very reassuring. Another question for you. Congressman Darrell Issa, who represents San Diego and part of East County, just introduced a bill. What he wants to do is allow people, instead of having to show proof of vaccination at some locations, give them the option to show proof of COVID antibodies, not just that you tested negative, but proof of antibodies if you've already had COVID. So my question is, how long do the antibodies, what do you think about that idea? And how long do antibodies last after somebody has had COVID? How often would you be having to do this to make sure that someone's not transmitting it again?
So I'm going to skip on the policy question and probably just address the scientific question.
Okay.
Okay.
Sure.
So what we do know is if you've been infected and you develop antibodies, those antibodies are not as specific, as good at targeting COVID than if you get the vaccine, because the vaccine really gives you about 30 to 50 epitopes, which is sites of attack against the virus. So because of that, we've also followed these cases along, and natural immunity can last up to about 9 months. But we see that if you compare someone who's been infected, get the vaccine, versus infected and don't get the vaccine, you're over 2 to 3 times more likely to get COVID again.
Wow. Now, is that because there's new variants? Maybe you had the original version and now we've got Delta and all of these others out there?
We don't quite know. We can see the results. I don't think they've dug into the underlying cause. My suspicion is, again, when you have the vaccine, you have presented your body with an exact picture of what the virus looks like from the outside. Whereas if you get natural immunity, you're getting a picture of all the little pieces of virus that may be internal. So you may be looking at
Mhm.
different stuff from the virus.
Yeah.
That's so you don't target the virus as well. It's not as clear a picture of what the virus looks like. Whereas the vaccine gives you exact picture of what the outside of the virus looks like, and you can attack it before it even starts to invade your body.
Yeah. Now, I just got the booster, the Pfizer one, about a week ago. I was actually very pleasantly surprised that I had absolutely no side effects at all. I did after the second one, nothing serious, but I felt like I had kind of
Mhm.
been knocked off my feet for a day or two there with, just the body aches and things and fatigue. None of it from the third one. Is that unusual, or are very many people having much in the way of side effects from the booster shot versus the original two or
Yeah,
original one in the case of J&J?
yeah, I've heard some anecdotes as well about, hey, maybe this the third booster really knocked me out. But that's why we've conducted the studies and looked at it and say,
Yeah.
no, it actually is about the same as the second shot.
Okay.
You have local reactions, you have inflammations, and with that, all you do is put some warm compresses, some rest, and
Mhm,
and you're fine.
mhm.
You can get some fevers and body aches and systemic reactions, and those are normal. That means your body is doing its job
Right. So just
more.
trying to get it on a day when maybe it's your
Yeah,
day off and
yeah, it's it.
you
But
can laze around.
overall, it shouldn't be worse than the second dose.
Okay. That's good to know. What's the latest locally on the COVID scene? I know San Diego has been doing much better than the nation as a whole in terms of the percentage of people who are vaccinated. Last I checked, last week at least, it was 80% were fully vaccinated of those over age 12, everybody eligible. And I think almost 90% had had at least one dose.
Yeah.
So what's that translating into? Are we seeing a lot less
We
cases?
are seeing, we are definitely seeing a decline in cases. And again, even now, if you look at who's ending up in the hospital, about 90%, 88 to 90% are the unvaccinated. So
Mhm.
unfortunately, this is a major burden of the disease is on the unvaccinated.
They're
Um,
11 times more likely to die of it now and 6 times more likely to get it, according to a study the CDC published about a week ago, which was kind of shocking. But we should also mention that vaccinated people are not necessarily, it's not impossible for them to get a serious case.
mhm,
Sadly, we just saw former Secretary of State Colin Powell, who at 84 passed away, even though he was fully vaccinated, but he had had cancer,
mhm.
blood cancer, Parkinson's, some other things that weakened his immune system. So, does this emphasize, I guess, the importance of why people should
Well,
be vaccinated, even if they
yeah.
think they have a strong immune system? Because if we don't all do this, those people who are vulnerable, who either can't get vaccinated and some can't, or who have a weak immune system, even with the vaccine, too weak for the vaccine to fully work,
Yeah. No,
still
so
keep getting exposed.
two thoughts about that. Number one is we know that the immunocompromised do not always take, meaning you can give them two doses vaccine, they have still not developed the appropriate level of neutralizing antibodies to
Mhm.
defeat this. And that's why FDA over a month ago, they were the first ones to give an additional dose to the immunocompromised. So
Yeah.
that's number one. And that's still the population I'm most concerned about. 65 or older and the
Right.
immunocompromised. But think about this. Think about this, Miriam. What if everybody around Colin Powell got vaccinated and didn't have the disease? He would
Yeah.
never catch it.
True.
He would have never caught it, and he wouldn't have had to die from this. So,
Not to mention masking and social distancing and
yeah.
the other things we can still do, even if we're vaccinated, if you're around somebody who's that vulnerable.
So if you can protect each other, so not thinking about me, but thinking about us and thinking
Mhm.
about our neighbors or kids or family members, if we can all protect each other, we can get through this. If we can eradicate this virus from the face of the earth, we will be better off.
Yeah.
And this is the way to do it. And the way to, end this pandemic is really through the vaccination process. So
Yeah. I saw a cartoon with somebody who said, you know, was on a ship and said, I want to dig a hole through the bottom of the ship. And everyone else said, but wait, we're all on the same boat here. And it seems like it's kind of the same principle that applies to COVID-19, doesn't it?
It does, and I'm actually very proud of San Diego. Our Health and Human Services, all our health systems really have rode together to get up to 90%, 89, 90% first dose and 80%
Yeah,
fully
that's
vaccinated.
amazing. There's some places that aren't even to 50% yet. So we're,
Right.
shout out to San Diegans there for rolling up your sleeves and helping protect all of us.
That's right.
What else would you like our audience to know, Dr. Tseng, about COVID-19 and the COVID vaccines and boosters? And with that, can you let us know how soon are these boosters going to be here for those Moderna and
Sure.
Johnson and Johnson folks that have been just waiting for it?
So they got approved today, and so what will come out is probably either by tomorrow or by this weekend, we'll be able to start seeing it out in public
Yeah.
to get vaccinated.
We're taping this on Thursday, October 21st, for those of you that are listening maybe a couple days later on the radio.
So what I'm excited about is really what's coming up, which is on the 26th, the children's vaccine is going to be discussed by the FDA.
That's my next question is, when do you think that'll be approved?
It's coming up. So they'll get the approval or review from the FDA. And then on the 3rd or the 4th of November is when the CDC will look at it as well to see that how do we operationalize this and what's the best population to work for. But we're only looking at age 5 to 11. The kids under 5, the studies are still ongoing. And we really do want to be extra careful with kids as well.
Sure.
Just to make sure that all the I's are dotted and T's are crossed. So, but I think that's
absolutely. Yeah. Can you speak to how rigorously the tested children have been compared to the testing in the adults? I mean, we've now seen, hundreds of thousands or millions, I guess, hundreds of millions of doses worldwide and even in the US administered for the adults. So we have a pretty good idea now of how safe these are and what the side effects, though rare, can be. How does the children's testing compare to that?
So we've looked at children's and looking at the dose. We can first tell you don't just pick a same dose. You want to pick a smaller dose. So it is a smaller dose of Pfizer. And we've noticed that even with the smaller dose, they're getting the same amount of neutralizing antibodies. So we really make sure that we have the appropriate dose, appropriate frequency, and that it is going to work. We also look at the side effects and actually are extending some of the studies to make sure that we be extra careful with our kids as well. I think we'll see what the results show. I don't have all the data yet, but we do know early on that it will be a smaller dose.
Very, very good. And you're satisfied with the safety of what you've seen so far on the preliminary results?
So far, it looked good. So far, it looks effective.
Good. That's wonderful to hear. So Pfizer is the one that's likely to be approved for children, you think, first over, I don't know, is Moderna or Johnson & Johnson working on that at all? Or,
yeah, they're coming up on the wings. I don't have the dates for them yet, but what we do know is FDA has a meeting set up on the 26th and ACIP will be early November.
Very good. Well, I really want to thank you so much for taking the time to join us today on the East County Magazine Show on KNSJ 89.1 FM Descanso, as well as for the podcast that we'll be posting on eastcountymagazine.org. I'll let you have the final say, Dr. Tseng. Is there anything else that you would like our viewers and listeners to know?
No, I think, again, everybody stay safe out there, get vaccinated. Let's protect each other. And the vaccine is how we're going to end this pandemic. So stay safe.
Very good. Thank you.